Hey, what's going on, everyone? Okay, gonna give it a little bit. Gonna wait until this thing pops up here and share. Cool. Okay. All right, guys. We'll start in a little teeny bit. Okay, just gonna get a sip here. Doing my weekly coffee in a glass. Of course, I told you guys easy way to decrease various exposures to microplastics by simply drinking liquids out of a glass, especially if they're very hot. That's also critically important. So having some organic coffee here I found at Sprouts. And also, you guys, I'm getting no endorsement kickbacks on these. These are just things I buy. I've been experimenting with various different mushrooms in my diet. And also, I told you guys last week I was using kind of like a mushroom blend powder, like an organic powder I found at Natural Grocers. Probably should have just brought the can here to show you guys again. But I've been throwing it in my coffee, and actually it makes like a pretty good difference. And also, I was able to find these morel mushrooms sold at Sprouts, which is really cool. If you guys, I took up mushroom foraging again. I'm actually going to go again tomorrow. But if you find these guys out in the wild, it's like super, super cool. But the cool thing, and it's probably easier, is actually they sell them at Sprouts now as well. So I bought like a packet of it. At least at my location, they sell it at Sprouts. So I've been buying those guys and just thought I would share. So that would be pretty cool. So, okay. So you guys, we'll wait a minute or so. We're going to be covering how to build beautiful abs, a beautiful midsection, today on our live without destroying your back. Because oftentimes just people select certain exercises that deteriorate the intervertebral discs. And I'm going to go over which exercises to select so that you actually build resilience in your core, and thus you have more biological resilience in your spine and don't develop spinal injuries or disc injuries, to be more precise, and how you can develop beautiful abs as well. So let's see, I'm going to look over my notes here and we'll rock and roll. So you guys, my style, I'm just going to go down a list of variables to focus on. Joya, what is going on? It might be a private live today, but we're going to be covering how to build beautiful abs, or how to train to develop like really good aesthetically appealing abs without injuring your lower back in the process. So you guys, welcome to ask any questions whatsoever. I'm going to have 5 different variables or talking points we're going to be focused on today. And some are more important than others. It's, again, just depends on which stage of the journey you're on. And the most important thing, you guys, like I always say in my lives, is don't take information you hear on social media at face value. That's so important, okay? Even for me. Like, I never met you guys personally. I don't know your particular situation. If you've had already reoccurring injuries with back pain or back injuries, these are so important to consider. And if people are just blindly giving out advice online without knowing your particular situation, and you kind of like follow it and get injured, that's something to consider, you know? So always get like a proper assessment done. And the variables I'm going to be covering today are just variables I look for personally with my clients that I thoroughly assess, and then myself as well. So you guys remember, when trying to develop like an aesthetically appealing midsection, in particular, the core, you guys have to remember, is kind of like a broader set of muscle groups. So remember, the core, a lot of times people think of the core is just kind of the rectus abdominis, or those kind of six-pack abs people typically see at the front of the body, so like right here. And that's one of the muscles, but there's so many muscles in the core. So just in the trunk itself, you're looking at, you know, the rectus abdominis, which is the front of the abs. That's most people just kind of perceive that as the core and nothing else. But then you have the internal and external obliques. You also have the quadratus lumborum, which is the lower back. You have the transverse abdominis. You have the erector spinae muscles and the multi-ifidi as well. And then also remember, actually, the lats are also these big muscles. They're like the biggest muscles in your upper body, are also part of your core. And your glutes, you know, all of the muscles in your butt, your pelvic floor muscles, etc., are also actually part of your core. All those muscles, if trained correctly, are supposed to work as one unit to basically stabilize the hips and the spine. And that's what creates a lot of strength, movement efficiency, so you don't have any kind of movement leaks, and also an aesthetically appealing and balanced looking midsection. Okay, so the number one thing is when you're trying to develop visually or aesthetically appealing abs is just having a lower body fat percentage. And for males, you're looking at like anywhere between 10 or 12% for your abs to actually start showing. And that's kind of like if you want, it depends on what type of look you're aiming for. If you're looking for like razor sharp abs, I mean, to the point of like where your abs look like they have abs, everyone is a little bit different. For me personally, is around like 5 or 6% body fat. And when you get to those abysmally low single digit body fat percentage, like nobody keeps this on long term. If you see your kind of like favorite Instagram influencer or whatever keeping this on long term, 100% guaranteed they're just doing that with drug use. Okay, and it's not healthy at all, whether you do it naturally or with drugs, especially with drugs. It's moreover, you kind of want to do that for maybe like before and after pictures, just to have like a very dramatic looking transformation, or maybe just for the experience of it. I think it's really cool to at least do that like once in your life, if that's like a core priority for you, because you basically kind of look like you're photoshopped, but like in real life, you know? And it is really cool to achieve that and kind of basically look like a comic book character. And usually what people do, especially if they're kind of like in the fitness profession or modeling, is typically they get into this peak condition, so these abysmally low body fat percentages, and they take like a bunch of photos within like a month period while they're in that peak conditioning with various different outfits and different scenarios. They do a lot of video content in different gyms, et cetera, and then they kind of post it throughout the year. But when you meet these people in real life outside of that peak season, like they just really kind of like look normal for the most part, and definitely don't look this ripped at all. So they're kind of posting this content throughout the year, and it gives the illusion that they look like that all the time, but really they don't. It's just for like maybe 5, maybe 10% of the year total they kind of look like that. Okay, and it's generally not recommended for good metabolic health or hormonal health as well. Typically you're definitely never going to be able to add a significant amount or any muscle whatsoever by being in single digit body fat percentage, especially if you've already surpassed the newbie gain window of your lifting maturity of like 1 to 2 years. So typically within that window, presuming you're on a good, well-designed program and a good lifestyle program, you'll put on a significant amount of muscle. And if you're already outside of that window and you're kind of hovering at a very low body fat percentage for long periods of time, it's definitely holding you back from putting on a decent amount of muscle on your frame. And one other thing to consider is when people try to cut down to a very low body fat percentage to get their abs to show more, you have to remember, for you not to look very, very skinny everywhere else, you already have to have a decent amount of muscle mass. People think like, oh, I'm going to cut down to this very, very low body fat percentage while putting on muscle at the same time. Gavin, good to see you. They think like I'm going to lose 20 pounds of body fat and gain 20 pounds of muscle at the same time. And that's like literally impossible to do, except for extremely rare circumstances where a person has never lifted ever before and they happen to be like very obese, or they have lifted before but they got injured and they're inactive for 8 to 12 months while recovering from like a disc injury, for example, which takes roughly around that amount of time, if not longer, and they get back into the fitness game, and they happen to gain a lot of muscle while cutting excess body fat. But really what's happening is they're gaining muscle back that they've already had, but they just basically lost through inactivity because they're injured. There are a few other exceptions. Honestly, like probably anyone with a decent social media following in the fitness space is taking a tremendous amount of anabolics and other drugs that they're probably not talking about. Although it's becoming more open for them to talk about it and make it obvious that the reason they look like this only, it's not because of some secret knowledge they have or they know something you don't know. It's just they're just using a lot of anabolics and stuff of this sort. That's another case where a person could lose a decent amount of body fat and gain a decent amount of muscle at the same time. So when you're trying to cut down, just understand that it's best to have a good amount of muscle on your frame already. That way you don't look too thin and depleted when you get into that 10% body fat range and below, because at a certain point you're going to have to make a trade-off. If you want your abs to look even leaner and more ripped, you're just going to lose size everywhere else. And although the end product, your abs may actually look much better, just the rest of your body looks much worse. And also taking into consideration that usually people's facial structures, once they get below 10% body fat for males, typically for most, there are no absolutes, kind of starts looking fairly sick. You know, they get the really sunken in cheeks, a lot more pronounced cheekbones. Their eyes tend to kind of sink in more into their sockets. And it's kind of like not a good look overall. So although their abs may look good, just the rest of their body looks very thin, and then their face looks too depleted as well. So these are all things you want to take into consideration when you're trying to develop aesthetically appealing abs. For sure, you want to look at the abs, but you want to look at the complete picture as well to better strategize on which direction you want to go. So you guys, for body fat testing, you can get a thing called a DEXA scan. That's the gold standard. They're pretty much available in any city. They take like maybe 5 minutes, 3 minutes to do, and you get your results pretty much right away. They're typically probably like $80 to $100 depending on your city. And it's pretty cool. That's the gold standard. It'll give you a very good, accurate reading of your body fat percentage. The average American male is around 27% these days. So I think like last time I read a report on this, 70% of American males are obese, and basically 85% are either overweight or obese. Okay, pretty soon, right around the corner, 90% will either be obese or overweight. So it's a very serious issue, and the average American male is about 27% body fat. And remember, you want to be at like 10 or 12-ish% depending on your frame and exactly what look you're aiming for to really have those sharp looking abs. You know, it's all about the body fat. Really, that's the most important thing to focus on, not any specific exercise or anything of that sort. That really doesn't have that much to do with it in the grand scheme of things. You just need to get to 10 or 12% body fat to have very good aesthetically appealing abs. And if you want to be like super, super ripped, then definitely below 10%. Everyone is different, but like I mentioned, my abs look their best to the point of like where your abs have abs between like 5 or 7%, somewhere around there. But this is just short-term, short-lived, just for picture purposes and a cool experience. And that's it. Because remember, if you hover around those low body fat percentages for a long time, your testosterone will plummet, and that's going to create a cascade of effect in your entire endocrine system. Because remember, all your hormones are basically kind of like a symphony. You know, when one instrument is playing, a whole bunch of other ones can't be playing to have comprehensible music. So it creates a cascade of effect, and most always not in your favor. So that's the number one tip. You know, just make sure your body fat percentage is actually at 10%, 12%, or below. For females, you usually start looking super sharp at like 20%. If you want to get pretty ridiculous, it's around 15% or so, and stuff of that sort. But all the same stuff applies to them as well. You don't want to be hanging around these abysmally low body fat percentages for long periods of time. So step 2 is we want to focus on exercise selection. So once you're clear on your goals and objectives, you want to focus on what tools will help me get there in the safest way possible without, in particular, hurting my back, my lower back, which a lot of people select exercise like the decline sit-ups, and they're like, oh, they will make you stronger in a flexion type of motion rather. But usually when your hips are locked in place and you're kind of bending at the lower back, that's just the movement you have to do to delineate and break down the intervertebral discs of the lower back. And it doesn't happen overnight. It takes many years, but eventually if you stick to those type of exercises, you will create a back injury, most likely if you're using the decline bench a lot in like the L4, L5, or L5, S1 is extremely, extremely common. you will create a posterior, most likely a posterior lateral disc herniation to the left or the right side, or sometimes both sides, or sometimes down the middle, or something of that sort, okay? So what exercises I like to select with clients and with myself, with my clients and with myself, and it depends on their injury history. This is why assessments are so important, and I did a thorough video, a solo cast on what a proper core movement and low back assessment looks like. And they take 2 to 3 hours. They're not like a quick Q&A and then here's some medical drugs and on your way. And oftentimes they require a lot of follow-up because you have to, in a way, look at the person's training technique and their movement competency outside of the gym as well, among various other variables. I'll just link that episode in the comments section right below this video so you guys can check it out. But generally speaking, the proper way to train the core is to integrate, not isolate. No absolutes. There are some minor exceptions to this. Again, if a person has very poor movement competency or is overcoming a very, very, very serious disc injury or has maybe something difficult to deal with like spondylolisthesis or very progressed stage of stenosis, it's kind of narrowing of the spinal canal. All these things have to be taken in consideration. This is just for healthy low backs. Okay, so you want to integrate the core and you want to avoid movements where your hips are fixed and you're flexing at the lower back. You want to avoid those because those will cause low back injuries eventually. Again, it's kind of like smoking. It's not going to happen overnight, but eventually you will etch away at that annulus fibrosus material of the intervertebral disc, and eventually that nucleus pulposus material will pop out. And for a lot of people, it pops out right into the nerve, which is what causes that intense nerve pain in the low back, which radiates, which could be localized, particularly in the low back, or it could radiate, down the left side or the right side if it's a little bit higher in the back, down the front of the leg as well, if it's the femoral nerve root instead of the sciatic nerve root, etc., etc., okay? So safer exercises for the low back to do are, like a very beginner one, is a dead bug. You can check it out on YouTube. There's like 10 trillion different instructional videos at this point, and various progressions and regressions of the dead bug as well, depending on the person's needs. You'll notice with this exercise, the spine is always straight. It never goes into a flexed position, especially under load. And that's kind of the idea you want to be carrying when selecting the proper ab exercises for you. And the cool thing about the dead bug is it's a very stable movement because you typically do it on the ground. So it's a good place to start for beginners, especially if a person is compression intolerant. So more advanced movements you could do are kind of like a Swiss ball crunch. Now, you got to be careful with these because once you take a person from a stable platform, like laying on the floor, to an unstable platform, like a Swiss ball or a Busso ball, for example, the compressive penalties on the spine double. So if a person is compression intolerant because of some localized back pain, this will increase their back pain. So you want to avoid that and then properly progress into that over many, many weeks. You guys have to remember, if you have especially like a rupture, like an actual herniation of the disc, and it's kind of protruding out, you get an MRI done, for example, and you see the disc itself is fairly dark, and you have this kind of protruding material from the disc. It takes many months to sometimes years for the body to metabolize that protruding material, to eat away at it, basically. And then once it eats away at it, it chips away at it, it stops pressing on the nerve root and you stop having the pain. But the actual gristling of the disc and healing of the disc could take up to 6 to 10 years. Okay, it's a very slow process because unfortunately intervertebral discs don't have arteries going into them, or large arteries going into them, so it doesn't have a decent amount of blood flow, and thus the tissue doesn't heal quickly. People have tried various things over the years to kind of inject the disc with some kind of material to help close it in faster, but the body typically senses this foreign object and kind of repels it, and nothing promising has been discovered yet. So And for you guys, for you guys on the call that are questioning whether if you're already in pretty serious back pain and whether you need back surgery or anything of that sort, I did train a few back surgeons over the years. I've even hired Stuart McGill, which is a very knowledgeable low back pathology researcher, world known or whatever, world respected. Worked a lot with Brian Carroll, it's a very good, respectable figure in that industry as well, and studied a lot of Paul Chek's work, etc., etc. And the general idea is with low back surgery, at least like what I go for, if your pain is so great that you're willing to take a knife to your own back because it's that intense, then probably surgery is a good idea at that point. But before then, it's probably a risk worth avoiding. And a lot of people would say, like, if you look up at the research, a lot of people that do get back surgery, they report feeling better initially simply because they laid off all the pain triggers and all the exercises and all the movements that were leading to their back pain. And if they just did that all together, they would also feel pain relief, But if you do a long enough follow-up, usually 2 to 3 years with people that had back surgery, without getting thoroughly educated on their pain mechanism and re-educated on their movement patterns outside and inside of the gym, which takes so many sessions. Okay, it's not a quick, again, like 5-minute chat with your doctor, here's some medical drugs, and out the door you go. It's not going to happen under those situations. What I do with clients, for example, is usually a 2 to 3 hour assessment with just the low back and their movement. And then we do like 6 months meeting once a week to practice movement competency and address any other issues that are hindering the lower back, such as being overweight. That adds a tremendous amount of pressure and compression and shear penalties on the back. So a lot of times just kind of losing 30 or 40 pounds can help you a tremendous amount with your back pain, among various other things. Changing a person's diet so that they have the right nutrients to help that disc heal properly, etc., etc. But some other exercises, more advanced, are kind of like the ab roller, but done correctly. So you're keeping your back perfectly straight the whole entire time. And ideally, you're training in a way you have a good mind-muscle connection where you're integrating the butt, all of the ab muscles, and your lats into one muscle because they all work as one integrated link or unit to help stabilize the hips and the spine as well. Stir the pots is great. And there's so many varieties of each of these exercises too. So trust me, you're not limited. And then wood chop variations are also amazing. And I try to coach people on wood chop variations to not kind of twist at the hips, or rather not twist with the hips being locked in, but twist with the hips. That's personally how I educate people. That way you don't have any of that torsion pressure on the disc of the material as well. And you're able to train in that exercise in particular, the whole trunk, but with a little bit more emphasis on the external and internal obliques, with a bit of the gluteus medius and quite a bit of the gluteus maximus involved too, if you're coaching correctly. And just right there, you have kind of the low to high variation, the middle variation, the high to low variation, etc., etc. You're limited only by your imagination at this point. V-ups are also great, but kind of educating the person to do it in a way where they're, I found it beneficial where their like hip bone, for example, or pelvic bone doesn't actually lift off the floor. And knee tucks, also on like a decline bench, are great as well. Again, it allows you to keep the spine straight, but utilize the core muscles, etc., etc. So one thing with the Swiss ball and the Busa ball, you have to instruct the person to not sit up fully. If they do it correctly, like imagine this is the ball here, this is the flexion that would occur with their body, They're not actually sitting up like this because then you're replicating that hips locked into the position and flexing in the lower back, which again would lead to a back injury eventually, okay? So finding exercises that keep your low back in particular straight and are able to integrate all of the muscles of the core into one unit is ideal, okay? But remember, the most important thing is really just kind of having that lower body fat percentage, okay? 10 to 12 for males and 20 to 15-ish for females. 15 is more on the extreme side, and stuff of that sort. And these exercises you can do moreover for the function of the core. So step 3, like I mentioned, kind of stay away from ab exercises that fix your hips in place. So, like the ab crunch machine, where you're kind of sitting and you're crunching down, but it locks your hips in place. You definitely want to stay away from that, especially that machine in particular can load the spine even greatly because you're using your hands to crunch, and then you could also kind of plate load the machine. I would stay away from any decline sit-ups, and also Russian twists are going to be really bad for those intervertebral disc. Yes, all of these exercises do train your abs, and they train the musculature of the abs, but the expense of the health of your intervertebral discs, there are 5 of them in the lower back, where the exercise I listed above do train your abs as well, but not at the expense of the health of your intervertebral discs. And on top of that, it establishes better movement patterns as well. So it helps reinforce those good engrams, okay? So it's all about like, yes, this exercise gets the job done, but at what cost? And are there alternative exercises that could also get the job done without that cost? That's important to consider, okay? So, okay. Step 4, another thing to consider, guys, is kind of look at the broader picture, okay? So some things you can do to keep your core very narrow are avoid like standing overhead barbell presses or dumbbell presses. This typically requires quite a bit of core bracing, and usually what happens is it expands your external obliques, so it kind of makes your core look quite blocky. You see this in a lot of CrossFit athletes, in males and females, and you see their kind of external obliques here kind of are pretty dense and muscular, and it does allow them to perform certain exercises with a lot more movement efficiency, and they're stronger. But visually, remember, the wider your core is, the more narrow your upper body is, and you kind of start looking very blocky. You know what I mean? So you want to kind of avoid this if aesthetics is your main goal. Also, like really heavy back squats will increase your trunk as well, and possibly deadlifts as well. Let me see my notes here. I have trouble reading my cursive here oftentimes. But having that exercise selection is critically important too. You want to take kind of a broader look on how could I keep my midsection looking razor sharp thin. So obviously avoiding standing overhead barbell presses, but also taking into consideration that, hey, if I build very wide shoulders or a very broad and wide chest, that alone will make my midsection look much more narrow and much more defined. Or if I do a lot of pullover motions in my routine, I kind of develop those muscles near the ribs, which connect the chest and the midsection very well and give it a much more aesthetically appealing look as well, et cetera, et cetera. So that's number 4. And then number 5, work on improving posture. That's huge as well. Your posture plays a big role in terms of how your physique looks and how efficient your body is at movement. So, like for example, I'm going to cover the 2 most common postural pathologies. One of them is a upper cross syndrome. So typically very rounded shoulders and protruding head. Not only does this add a tremendous amount of pressure and strain on the shoulder complex area, so it's kind of this upper back region, so it makes all of those muscles kind of very tender. It also puts a lot of shear pressure on the discs, those poor discs of the cervical spine. And neck injuries, especially the intervertebral discs of the neck, are just very annoying to deal with. So I would highly suggest you avoid those. And one of the things you could do to avoid those is simply just by having really good posture. So what you want to look for, I'm not even sitting in good posture right now, but I really just sit for maybe 2 hours a week maximum. What you want to do is just make sure, like for example, this is just a quick little tip, is just make sure your ears are roughly in the middle of your shoulders. Like they shouldn't be like way out here while your shoulder is way back here. Also, take note that wherever your head goes, like your shoulders tend to follow. It kind of works in synchrony with one another. So by training certain weak muscle groups to be stronger, and by stretching certain overly tight muscle groups, you'll eventually bring your shoulders back and down. And you kind of stand also in a more upright position. And one thing you guys can do, which is really cool, is take a tape measure, take your midsection section circumference while being slouched over, and then take it while standing perfectly straight. You'll notice that your midsection circumference is probably like an inch smaller. So just by standing straighter, not only do your shoulders look wider, and thus your midsection looks more narrow, you also carry a more confident appearance as well. But you also, more importantly, I would say, just decrease all that shear pressure on those poor discs of the neck, on top of making your abs look better and stuff of that sort. Another common one is the lower cross syndrome. So it's kind of like more over like a Donald Duck type shape. You see this in a lot of, you see this a lot, quite a bit. Not as much as the upper cross syndrome, but basically you have like a lot of curvature in the lower back, like too much lower dosis, it's referred to. And the butt's typically protruding way out with the kind of midsection plopping forward, especially the low abs kind of protruding forward. And it kind of causes this kind of distended gut type of look. So by fixing that, you can kind of get your midsection to kind of be sucked more in, and thus look a lot more leaner, and to a lot of people, a lot more aesthetically appealing as well. So posture is important to consider when you're looking at the broader picture of the person in terms of enhancing their aesthetics. And another one, which kind of goes in with the first one we talked about, is reducing your body fat, is just making sure your body isn't storing a lot of visceral body fat. So visceral is kind of just a fancy word of saying your organ tissue, okay? And there are basically two forms of body fat. There's body fat that forms around your organs, which isn't that healthy for you long term if you kind of hold on to it for years and years and years. And also the subcutaneous body fat, which is what's more popular for people to understand body fat as. That's usually like what you see, you know, kind of like the belly popping out right under the skin, for example. That's the subcutaneous body fat. So what happens, unfortunately, with the visceral body fat is it kind of pokes the gut out. And in some cases, you see moreover with males, you see you can barely squeeze any body fat on their midsection, but they have this huge belly. You know what I mean? So it could be an indication that they have just not that much subcutaneous body fat, body fat right under their skin, but they have a tremendous amount of body fat around their organ tissue, which is kind of pushing everything out, and thus creating this kind of distended gut appearance. And that would need to be reduced to have like a very flat and firm appearance. Some other things you can do, you have to remember with physiques, it's kind of moreover shaping and molding your physique with keeping in mind how lighting is going to hit it. So if you have like a very developed lower chest, for example, and you have already a very firm midsection, there's going to be a really nice shadow that goes down your midsection, and thus creates more of those shadows in those kind of lines and breaks, and makes the abs look a lot more pronounced. So all these little things you can kind of do to really enhance the aesthetic appeal of your midsection. And those are the variables I wanted to cover today. There's so much more to cover, but you guys, these 5 tips are already gold. Just remember, you got to have a low body fat percentage. 10 or 12% is considered low, or below if you want to get really ripped. You have to select exercises that get the job done, but not at the expense of your intervertebral discs, okay? You don't want a low back injury. And I listed a bunch of exercises you can select. And at that point, it's just figuring out where you need to fit into the journey. So sometimes you'll need to regress on certain exercises, like start off with the dead bug. Sometimes people are already set to go, so they could do more advanced stuff like the roller or the stir the pots, or stuff of this sort. But you definitely don't want to be doing the roller, for example, if your back is already very sensitive and you're shear intolerant, meaning these are the discs and you're intolerant when there's kind of pressure of this sort. Then that exercise will cause you pain and might re-injure your back. So would the stir the pots, for example, and possibly the wood chops. Or possibly they might not, but you need to regress to a lower weight, a lower rep range with longer breaks in between, etc., etc. So another key takeaway we covered today is make sure to stay away from ab exercises that fix your hips. So like a decline sit-up, okay? Yes, they will train your abs. You will get stronger abs doing the decline sit-up, but not much else, but at the expense of those poor discs, you know? So it's not a good price to pay. And then we talked about looking at the broader picture, you know, outside exercise selection, like trying to avoid the standing overhead barbell press to make sure your trunk doesn't look too blocky. And also, the last thing we covered is making sure you focus on your posture, you know. Good posture already improves your aesthetics quite a bit, and making sure you're keeping a lower visceral body fat percentage and stuff of this sort. So, okay, so I hope you guys found that helpful. Have a good weekend, and I'll see you guys around. Take care.